Back to school can be a very exciting time for both parents and children, but the pandemic requires everyone to prepare differently than before. Parents need to make sure their children are ready to return to the classroom healthy and safe. Our experts, Dr. Caroline Olaleye, Dr. Allison Bartlett, and Dr. Ed McDonald, will provide parents with information, including the importance of getting vaccinations, the need for exercise, and even how to prepare healthy school lunches. They will also provide helpful tips to help parents and children manage their stress and anxiety during these challenging times. And they'll take your questions live. That's coming up right now on At the Forefront Live. And we want to remind our viewers that today's program is not designed to take the place of a visit with your physician. And Dr. Bartlett, you're actually joining us on set. We're trying to do things in a distanced fashion due to COVID. So you're a ways away from me.
Correct.
Our other physician that's going to be on the program is attempting to join us remotely. We're having a few technical issues. We'll try to get to Dr. Olaleye, but we wanted to go ahead and get started. So let's have you tell us a little bit about yourself and what you do here at UChicago Medicine.
Sure. My name is Dr. Allison Bartlett. My medical specialty is pediatric infectious diseases. I also wear a bunch of different hats here at the university, including as Associate Medical Director for our infection control program. So I've been up to my eyeballs in all things COVID. I'm also the quality chair for the Department of Pediatrics, so making sure that we're doing right by all of our children.
Great. And, you know, COVID obviously is kind of, I think, the number one thing that's on the minds of folks recently, and particularly with kids going back to school. So we're going to talk at length about that today, and we're going to also take viewer questions. So if your child's going back to school or has already started school and you have a question for Dr. Bartlett, just type it in the comment section. We'll try to get to as many as possible over the next few minutes. And let's start off with talking a little bit about the vaccination, because there are still folks out there that are quite nervous about getting the vaccination or having their kids vaccinated. And I'll say right off the bat, you and I are both vaccinated, and it hasn't impacted us in a negative way at all, only in a positive way. But if you could talk a little bit about pediatrics vaccinations.
Sure, absolutely. And in full disclosure, I have a conflict of interest that I have 3 sons who are all less than 12, who are therefore not vaccinated. But my 12-year-old, or my twins, when they turn 12 in October, that's their birthday present, is they will be getting their first dose of their vaccine.
Great.
So, you know, it really is important that everyone who is 12 and older get vaccinated to protect all of the children who are unable to be vaccinated. It is a very safe vaccine. Over 5 billion vaccine doses have been given. I mean, that's just an astronomical number. There are some side effects associated with the vaccine, sore arms, maybe some aches and pains. And I was knocked out for sort of 24 hours after my second dose. But now up and about and fine, and really is an important thing for us all to do.
You know, I was one of the lucky ones. I got my first dose and I had just a little bit of a sore arm, but nothing more than any other, like a flu vaccine or anything. Second one, I had nothing. Yeah. And it's been great because it's afforded me the, you know, that safety and that barrier to keep me safe as I go out and try to live my life, and that's so important. Now, you mentioned your children are all under the age of 12.
Correct.
And let's talk about that a little bit, because I know that's one of the things that folks are wondering about. Why that cutoff for the vaccine, and when will children 11 and under be able to get it?
That is really the million-dollar question,
Yeah.
and I'm a little disappointed we don't have a vaccine for the younger kids now. There's no reason to doubt that a vaccine for this younger age group will work.
Yeah.
Really what's happening is they're looking at how low can you go in terms of dosing so that kids get a great immune response but don't have unnecessary side effects when we give it. So they're looking at about 1/3 of a dose for the kids 5 to 11 and about 1/10 of a dose for kids younger than that. And so studies are just ongoing, and hopefully by fall or winter we should know. I think one of the concerns that comes up that parents have heard about is the risk of myocarditis, or inflammation of the heart, which is seen with some of the mRNA vaccines in predominantly men or boys younger than 30. Yeah. So we haven't given vaccine to a ton of kids less than 12, so we don't have as much data as we would like. Yeah. The good news is, of the cases that have been reported, it is a mild inflammation. Some kids will have chest pain, short of breath, maybe hospitalization for a day or two, and it gets better on its own with supportive care. Yeah. Again, in the studies with the vaccines, it was 8 or 20 cases per million doses. What we also know is that this discussion is not happening in a vacuum. People who get COVID infection, kids who get COVID infection, can absolutely have inflammation of the heart and many other consequences, and the risk of that happening when you have an infection is much higher than anything you would get from the vaccine.
You know, I like what you said earlier about on their 12th birthday, that's going to be a gift. And I know we're talking primarily about children and pediatrics, but I also want to get that message out to adults. It's kind of a gift for your family, really. Get it yourself, get it for family members. I don't know how many stories I've read about parents who die and leave children behind because they didn't think the vaccine was safe or they didn't agree with it or whatever. Well, think what you're doing to your kids, and you don't want to do that to your family.
No, and I mean, there's definitely been an increase in vaccination of late, and it breaks my heart that a lot of people are deciding to get vaccinated now because of all of the deaths that we're seeing. Yeah. Like, it's really disappointing that that's what it's taking.
Yeah. So when kids go back to school, because they are, and some already have, what are some of the things that parents need to know to, first of all, maybe allay their fears, and secondly, how do they keep their kids safe going back? What are some good practices?
School is so important for our kids. Learning in person for the vast majority of kids is a much better way to learn, and it's not just the education that happens in schools, right? It's the social and emotional development, it's the meals that are served, it's the other services available. Also, it lets the parents go back to their jobs and provides work for all the people who work in the school systems. School can absolutely be done in person safely with all of the things that we've learned about how to decrease the risk of COVID. Wearing masks, keeping distance, 3 feet's probably enough if we're all masked. Outside is still safer than inside, so take advantage of the next few months of weather to do as much as we can outside, including, as we'll get to, physical activity and staying healthy and active to kind of get everyone's energy out. It really can be done if we all are committed and work together.
So we do have a couple of comments and questions from viewers, so I do want to get to those. And so the first one is from Sabrina, and it's a comment, but it's something that you could address probably. I'm fully vaccinated, but I'm worried about my grandsons born at UChicago Medicine. What would you tell somebody who has a child or a grandchild that's been recently born? What are the dangers there, and what should they watch out for?
So that's a really good question. We need to remain reassured about what we know about COVID infections in children. It is still very likely that children who have COVID infections have minimal to no symptoms. A very small percentage of children will end up in the hospital, maybe 1%. So the risk to any individual child is low. Our concern is that when we have a week like last week where there were 180,000 kids in the US who got COVID, 1% of that is still too many. Yeah. And so, working together as a family to implement as many things you can do to reduce the risk. So all the adults and everyone over 12 around that child being vaccinated is fantastic. If the child is going to a child care setting, make sure that's somewhere where sort of masks are being worn by the adults that are around the child. And again, keeping the child out of high risk indoor situations where you don't know the vaccination status of everybody.
And I still think there are a lot of folks out there that don't really understand masking, and I know we've talked about it 1,000 times, but people still don't get it. And one of the ways I explained it to someone was, when you go in for surgery, that surgeon, he or she is wearing that mask to protect you, not them, and that's to protect the projection of droplets and that sort of thing. So if you wear a mask around the child too, if you're worried, probably not a bad idea.
Absolutely. And I think back to the getting kids in school, kids get this.
Yeah.
They understand I'm putting my mask on to keep my friends safe. It's really a much simpler concept for first graders to understand than some adults.
A couple more questions from viewers. How about the non-mRNA Novavax?
Yeah,
mRNA, sorry.
Okay.
Vaccine.
We don't know anything about it in kids yet. It's only approved for 18 and over. There are a few brands. The Johnson & Johnson one is the more common one here in the U.S. You've probably seen in the news lately about booster doses being recommended. There's more information to come on that one. Yeah. But from a likelihood of giving it to children anytime soon, I think that's a farther distance off than the mRNA vaccines.
Because the mRNA vaccines really have been around for a long time, or a version. correct?
Correct. I heard someone give a great analogy about this where it's like, a football team that wins the championship. It's not because of the work that was put in, right, the week before the championship, right? It was the years of team building and everyone's individual work since they were a kid. That's where this mRNA vaccine is. It's 20 or 30 years of people's careers of work getting to this amazing point where we are.
Great. More questions from viewers. My son had COVID and now it's more than 15 days. How long can he be immune? I'm not exactly sure what they mean by that. And the next part of that question is, how can we check his lungs and heart to make sure that they're fine? That would be something a physician should do, obviously.
Yeah, of course. From the vaccine standpoint, we know that there is some time of protection after you've had a COVID infection. We usually say, certainly within 90 days, it's unlikely that you're going to have a repeat infection. But if you get new symptoms after that time point, it's worth considering a new infection. I think what's exciting is we're getting data out about what happens when you give a vaccine to someone who's already had COVID.
Yeah.
And actually the response that you get from the vaccine is supercharged. And so you get a much better response. And so one of the best things to do if your child is over the vaccination age of 12 is if you start their vaccine series now, they get an amazing response.
I'm glad you brought that up because I think a lot of folks think that if they've had it, they're immune. That's not necessarily true, first of all, and secondly, go ahead and get the vaccine anyway because then you'll be in better shape.
Exactly. There's definitely a degree of protection, but it sort of pales in comparison to the robustness and durability of the vaccination. I think in terms of sort of heart and lungs, we don't know a lot about long-term effects of COVID. Certainly we see the long COVID in kids, although much less frequently than we see it in adults. But in general, if people didn't have problems with their hearts and lungs at the time of their initial infection, there's probably not a whole lot of further investigation to be done.
Great. I am told we might have Dr. Olaleye back on the line. Is that correct? Let's see if we can bring her in. There she is. Hi, Dr. Olaleye.
Hi, how are you?
We are doing well. I'm so glad you're here. Whenever we have technology, there's always that chance of something just not quite working right, but I'm glad you're here.
Thank you.
Tell us a little bit about what you do here at UChicago Medicine, if you don't mind.
Yeah, I'm a general pediatrician, and of course I see children from 0 to 21, just for general medical care.
Great. So we've been talking a little bit about back to school, and there are a lot of parents, I think, that are pretty stressed out right now, and kids for that matter. What would you tell parents, and how can they help both themselves and their children, Dr. Olaleye?
Okay. Yeah, I think they will do well by just following what we've already been doing. Good hand washing, making sure the children wear the mask. Try to practice wearing the mask at home so that especially for the younger one, that way they're more familiar with wearing it when they're at school. Feed them healthy food, make sure they're getting good rest, just to keep their body and mind healthy to start with. That helps when they're also in school. It helps to protect them from getting infection, and also putting on their mask and washing their hands and keeping the distance as much as they can when they're at school. Just following all those basic mitigation rules that we've been doing, it's going to be very helpful.
And when would you tell a parent that it's a good time to seek professional help for levels of anxiety within their children? Because some kids have really struggled with the pandemic.
That's correct, especially with the social isolation that has accompanied the pandemic. It has have a lot of emotional stress or emotional strain on the children. They should seek professional help the moment it starts to make the kids feel very fearful. It's affecting their sleep, their concentration. Some of them become weepy. They just crying for no reason. They're trying to shut themselves in their room. And some of them are sleeping too much or not sleeping enough, eating too much or not eating enough. The moment it started to give them any physical symptoms, or it seems that they're getting too fearful or worrying excessively or getting depressed about it, they should try to get a physician to help.
Dr. Olaleye, we have a question from a viewer that I want to throw to you. And that's from Denisha, and she asks, for kids who tolerate masking well, would you still encourage it when they're playing outdoors?
Sorry, for kids who does not, that you got cut off there. The question?
For kids who do tolerate masking. I know we're asking for kids to do that inside,
Yes.
but what about outside when they're playing?
If they're outside in the open air, I think they're fine without the mask thing.
Okay, which is, I'm sure, what a lot of kids probably want to hear.
Yeah.
So talk to us a little bit about, Dr. Bartlett, this one for you. When people get the children 12 and up vaccinated, what are things that they should look for in case they are worried about maybe an adverse effect?
Great question. So, what we have seen with the experience of the vaccines is side effects, if they're going to happen within the first 2 or 3 days of the vaccine, and in general, fewer side effects after the first dose than the second dose. And so, like we talked about, pain at the site of the injection, some fever, some fatigue, really all are not unexpected. So same thing as swelling of the lymph nodes under the arm. The myocarditis specific symptoms are usually chest pain or a little bit of shortness of breath. And that happens 2 to 4 days, generally, again, after that second dose. So that's the time period to really have a heightened awareness.
And if you run into a situation like that, contact your child's pediatrician, obviously.
Absolutely.
Great. Dr. Olaleye, can you talk to us a little bit about the values of exercise for children, particularly during this pandemic? I know that's important no matter when, but it seems like it's probably even more important now.
Yes. Yes, they should try and get regular exercise, preferably about an hour a day. Keeping them active, running around, it helps with the weight gain because a lot of children gain a lot of weight during this social isolation during the pandemic. So it will help with that aspect. And also being active, it increases the endorphins production in the brain, which is a feel-good hormone, which can also help with all the possibility of the anxiety and depression that is already associated with the isolation. So exercise, you really cannot overestimate the importance of getting regular and adequate exercise. So it keeps them healthy. It keeps the weight to be within normal range. It improves emotional health. It helps with things like blood pressure, cholesterol, because kids do have high cholesterol too, some children. So it can help in so many ways. And it also helps the immune system. So keeping the children active is a good thing. Parents can help take a walk with them. They can play ball with them in the yard. And those who do not like to go outside, they can be indoor and still find something active to do. They can dance. They can use some of the apps that they have on their computer that they move with. There are some different apps that can help them with exercising indoor as well.
One more question for you, Dr. Olaleye, then Dr. Bartlett, I'm going to have you wrap us up. My daughter is a teacher, and so I think it would be probably valuable for teachers to know what they can do specifically to help kids as they work through the whole process coming back from basically almost a year away from their peers.
For the teachers, yes, encourage the children when they're in school to kind of talk, those who want to talk, create the opportunities for them to express how they feel, and trying also to kind of encourage when they're in the classroom to stay apart from each other as much as they can, even when they want to share secrets, and keeping their hands clean. Maybe they can have sanitizers or wipes close where they can have easy access to it. But most important is to try to encourage the emotional health while they're there, because some of them also have experienced either a parent's been seriously ill or even loss of parents or family member, which they're going to carry that emotion into the classroom. So to give them opportunity to just for the children to be able to talk, to be able to express themselves and to say how they feel about the situation, and be patient with them, because everybody at this point is on edge to some extent. So to try to be patient as much as we can.
Well, Dr. Olaleye, I'm so glad you could make it in. I know it was a little challenging to get through, but I'm glad you did.
Thank you.
Dr. Bartlett, I'm going to let you wrap us up for this segment. What would you tell those parents that might still be out there, who might still be on the fence about this vaccine, think it's dangerous or think their kid will be okay? What's that most important message you want to give them?
You know, I think that this is a very safe vaccine. And, you know, we are not going to get past this pandemic and back to, you know, unmasked time in school if we don't all work together. And there's plenty of vulnerable individuals out there that we all need to work together to protect.
Great, thank you. We are out of time for this portion of the program. Now we're going to try something new. Dr. Ed McDonald is also a trained chef, and he's joining us to show us an idea for a healthy lunch for your kiddos.
Hey everybody, how's it going? My name is Dr. Ed McDonald. I'm a gastroenterologist here at the University of Chicago. I'm also the Associate Director of Adult Nutrition, and I'm a trained chef. I love cooking, okay? So I like making healthy stuff for my kids. I want them to eat a lot more fruits and a lot more vegetables, and one of the ways that I do that is by making burritos. And in terms of vegetables, I'm also going to make a crudité, okay? So crudité is just a fancy word for a bunch of cut up vegetables. And we're going to make a lime yogurt dip. I'm going to put a little bit of chipotle sauce in there because my kids like spicy foods. I know that is abnormal, but whatever. My kids like spicy foods. I'm going to make it a little bit spicy. If your kids don't like spicy foods, you can keep the chipotle sauce on the side. All right, so let's get into it, okay? So for the beans and the burrito, pretty much the foundation for the beans and the burrito is pretty much just beans and some sort of whole grain. So you can use rice. I like using quinoa, I like using brown rice. Depends on what your kids like. So I have my quinoa here, and I'm also gonna throw everything in a pressure cooker, and I'm gonna cook the beans in a rice cooker. So you can cook the beans on the stovetop, you can cook the rice or the quinoa on the stovetop. For my purposes, especially since I'm here in the studio, I'm gonna throw everything in my rice cooker, okay? So for the quinoa, we're gonna keep it simple, okay? So the quinoa is basically a cup of quinoa and a cup of salsa. I like tomatillo salsa, and then 2 tablespoons of taco seasoning, and then a cup of either chicken stock or veggie stock, okay? So for the quinoa, we're just gonna throw it in a rice cooker here. I'm sorry, we're gonna throw it in the pressure cooker here. This is my tomatillo salsa. I'm just gonna put that in there. And then I'm gonna add a cup of veggie stock. And that's it. So the tomatillo salsa already has a little bit of salt in there, so you don't have to add a little extra salt. And then same with the taco seasoning that we're about to add. So this already has a little bit of seasoning in there. So I'm just gonna throw a little bit of that in there, okay? So, and I'm gonna reserve the rest for the beans, all right? So we're gonna put my top on here. So I'm gonna cook this 15 minutes in the pressure cooker, okay? Now, beans, super duper simple, okay? So I have a can of beans. I'm gonna throw the beans into the rice cooker, okay? So this is just 1 can of beans. I didn't drain anything. This right here is just 2 tablespoons of tomato paste. So I'm just gonna dump that in there. Matter of fact, I am gonna use a fork because it doesn't wanna dump. So I'm just gonna put that in there real fast. Give it a quick stir. And then I'm also gonna use my 2 tablespoons of taco seasoning, okay? So I'm just gonna dump everything in there, and that's it. You really don't have to do much much more than that. So we finished our beans. So I had the beans simmer for maybe about 10 minutes or so. If you're using a rice cooker, just press the button. Now, if you're doing it on the stovetop because you don't have a rice cooker, that's fine. Just let them simmer for about 10 minutes on low heat. You really just want to heat them up. Most of the beans are already cooked if you're using canned beans. Now, if you're gonna make beans from scratch, that's a whole different story. You have to like soak the beans or use a pressure cooker, but I'm not gonna get into that today. Now, my quinoa, this is what it looks like, okay? So it's nice and soft and fluffy. So you don't want to put too much in the burrito. You don't want to put too little in the burrito. So what's the right amount? And you know, honestly, I just kind of look at it. So this is a medium-sized burrito, and it looks like we're ready to go here. I'm going to use a panini press to essentially seal the burrito together, okay? So I'm probably going to put maybe about a 1/4 cup or so of the quinoa on here, and then probably about an equal amount of beans. And what I like about this, you can make multiple burritos out of this. So I really want to fill up, you know, almost maybe like a third of my burrito, okay? So I don't want to have half of it, that's way too much. I'm really looking for about a quarter to a third of filling up the actual burrito. Now, the trick is I'm going to put all my ingredients on one side, and then I'm going to fold the sides of the burrito like so, okay? And then I have just a little bit of burrito that I can pinch, and I'm just going to turn everything over. And as I'm turning, I'm tucking the burrito in, okay? So now I'm going to keep turning and keep turning, and then, I mean, look at that. So it looks great. So nothing's leaking out. You don't have quinoa going everywhere. And I'm just going to throw this on the panini press. It's already warmed, and I'm just going to press down, okay? So I'm not pressing too hard because I'm not trying to force all the ingredients out of the burrito, but I want to get a nice seal. Now, I'm trying to get some grill marks on here. Doesn't have to be burnt, okay? So I'm not trying to burn it. I'm just trying to get it nice, golden brown and delicious, okay? You can definitely use some tongs to just grab your burrito, and we're gonna set this down here. I mean, look at it. So this burrito looks amazing, okay? So I am gonna make the crudité now, okay? So the crudité, you really just cut up some vegetables, and that's about it. And we're gonna make a nice little dipping sauce to go with it, okay? For the crudité, we're gonna cut up some cucumbers. Got your cucumber here, and I'm just gonna cut some cucumber medallions. Now, whenever you're cutting, you really want to use this bear claw technique, okay? So I'm using my non-dominant hand to kind of stabilize the food, but also stabilize the knife, and I'm just cutting through it, okay? And I'm taking my time. You know, I know a lot of people are trying to be like Top Chef where they're cutting super duper fast. You don't have to do all that. That's really how you just kind of injure yourself. So you're not in the Chef Olympics, you're in your kitchen. So I have everything cut up, kind of ready to go. I'm going to cut up a yellow pepper here. So what I like to do with my peppers, the key is you don't want to get seeds everywhere. So on the inside of this pepper you have the seeds, and the seeds are actually somewhat spicy. So what I'm going to do is I'm going to cut the top off and just cut a little bit of the bottom off, and then I'm going to make a small slice in the middle, and now we can just cut along here and get rid of most of the seeds. Just be real careful not to cut yourself. All right, I'm just gonna cut up my pepper here. And I got small little slices, okay? So we're pretty much ready to go. And now we're gonna make our yogurt sauce, okay? So I have a cup of yogurt, nothing fancy. So this is just Greek yogurt, and it is full fat, so it does have a little bit of fat in there. I have this cool juicer, so we're just gonna juice the whole lime in there. And I like taking 1/2 at a time. So we're gonna juice that. And what I like about using a juicer like this, you don't have to worry about the seeds falling in there. So if you're juicing a lemon, you know, the seeds get everywhere and you're trying to get the seeds out, and it's just a mess. Those seeds can get real tricky. Now I'm just gonna give this a good stir, okay? Make sure it's nice and smooth. All right, and then you can add some of the taco seasoning, okay? So, you know, a tablespoon is probably good enough. So we're gonna add some of that taco seasoning in there and just kind of stir it up some more. So with the chipotle peppers, I'm not actually gonna put a chipotle pepper in here because the pepper itself is super duper spicy. However, these peppers are soaked in adobo sauce. So I'm just gonna use a tablespoon of adobo sauce in there, not to make it super duper spicy, but just add a little bit of kick and some extra flavor, and stir it up. I mean, look at it. It looks real good, okay? So, you know, it has a nice little color to it, a nice little kind of pink reddish hue. So you see here, I have my beautiful burrito. This is amazing. This looks good. I can't wait to eat it. So, you know, you can kind of just put it in there whole, and then now we're gonna do our crudité, okay? So nothing fancy. I just grabbed some carrots, some cucumbers. We're just gonna throw it in there. some yellow peppers, some green peppers. I mean, this is super duper simple. Now, another thing that my kids like, they love Cholula hot sauce, okay? They love it. And what I like about Cholula, it's not all that spicy, and unlike other hot sauces, it doesn't have a lot of salt in there, so it's almost like no sodium. Great for salad dressings, this is great for anything. So I'm just gonna throw it in there, and then all I have to do is tell my kids to make sure they bring it home. Unfortunately, they have thrown some of these things in the trash. They're not super duper expensive, but they're not free, so I definitely prefer them return them. Now I have my dip here. So with the dip, you can just throw it in here, okay? So I throw just a little bit of dip in there for the kids. And I like these little bento boxes, okay? So you have everything separate, and you just throw the lid on there, and it'll keep everything nice and separated, okay? I'll throw some fruit in there. So I have some fruit that I just grabbed from my refrigerator, and you know, I'll just throw it in one of these little bins. Also another bento box. Now you can mix it together. So sometimes I'll just throw some grapes and some cherries in here. All right, so now that I'm done,
All right, we are out of time. A special thanks to our physicians for being a part of our program today, and a big thank you to those of you who watched and participated in our program. I'm hungry now. Please remember to check out our Facebook page for our schedule of programs coming up in the future. And to make an appointment, go online to UChicagoMedicine.org or call 888-824-0200. Thanks again for being with us today. I hope you all have a great weekend.